Hi guys, welcome to my video again. So I'm back again with another content. Please subscribe if you haven't. Please subscribe because it supports my channel. Like my videos if you like them. I know my videos are hot. I'm hot. Okay, so back to the topic. I want to talk about the 4 P's of nursing. 4 what? P's of nursing. So as a nurse, there's so many things to consider when you're doing nursing, but there are these 4 really important aspects to consider as a nurse. Okay, so my number 1 P is pain. As a nurse, you have to make sure that the patient is free from pain. Give pain medication. That's your duty. You should do that. And when you give those pain medication in time, you avoid, patient calling you all the time because they're in pain. Makes your work go, faster and easier. Make your shift go smooth just because your patients are comfortable. It's very important, okay, to be free from pain. Number 2 is peripheral IV. What do I mean by peripheral IV? There's patients in the world who have IV access, whose medications are given through the vein. So as a nurse, you have to make sure that the vein is patent. You have to make sure that the patient gets his IV medications in time. You don't just sit in your station and the patient hajapata dawa, reason being the IV is out of place, or the IV has tissued. Please use your resources. If you're not able to do it yourself, you have a medical doctor, you have a clinician in your facility, you have an anesthetist. Kama wengine wameshindwa, please use your resources. It is very important for patients to get medication. That's the only way they can recover and go back to their families. So please consider that peripheral IV. Okay, so my 3rd point is potty. I'm sure you understand where I'm coming from, what I mean when I say potty. Just what you understand, what you mean, potty. So as a nurse, you have to be keen. Like in my other video, I said this. It is really important for you as a nurse to be very keen and attentive to details. Like if a patient does not pass 2 or does not go for short call in 24 hours or even 12 hours, is it normal? No. Because even you as a normal person, you have to go to potty. So it's very important for you to note if the patient does not, so that you can escalate, inform the doctor, so that the doctor can do something. Okay, so don't just sit there and mgonjwa hajaenda loo. He hasn't even passed stool for the past 3 days and he's feeding. So where do you think those wastes zinaenda? It is not normal. So please do something. Okay, don't just sit there. My last P is positioning. Please make sure your patients, those who cannot stand, are turned, are positioned well, sit well. There is patients who come from theater and the doctor advises to the patient should be positioned in a neutral position. Mostly those who are from brain surgeries. Okay, so please make sure that you follow instructions, you do what the doctor says. It is very important. There are these patients who are bedridden and they cannot even turn on their own. Please make sure that these patients are turned 2 hourly to avoid bed sores. Because even you try to put yourself in the patient's shoes and you've been sleeping like this for close to even the whole day. How would you feel? When you even seated on a chair for 2 hours straight without even turning, you can imagine how that feels. So please try to put yourself in the patient's shoes and turn them too hourly. Those who are able to, turn themselves and, get out of bed, help them walk around. Okay? Don't just let the patient lying there the whole day and you're there. How do you expect circulation to, take place in the body? By walking. That's how that happens. So it's really important to take note of that. So those 4 P's are really important. Please take note of them. So my number 1 is pain. Number 2 is peripheral access. Number 3 is port. Number 4 is positioning. Please take note. As a nurse, speaking on those things. Speaking, it helps our patients. Okay? So please subscribe if you haven't. Like my content. Thumbs up if you like it. I know I'm helping a nurse out there who's beginning, who's just in the field. Karibu sana. The field is good, nursing is good, so karibu. Please subscribe. Please subscribe. It helps my channel a lot, and it's free. It's free. You don't get charged for it. Thank you for watching my channel. Thank you, and see you next time.